announcing.
This was the scene at the Salvation Army's New Hope Center in Leslieville this afternoon. That's our health minister, Dr. Eric Hoskins, running to attend to a shelter resident who passed out and fell face first on the ground. Hoskins, a physician, as well as a nurse, provided care for the man who later came to relatively unscathed. Now, today's events underscored the need for the very services that Hoskins, along with Mayor Tory and several other dignitaries, were at the New Hope Center to announce. That's continuous medical care for 5 of the city's homeless shelters.
This government has listened. They've listened to people with lived experience, they've listened to advocates, they've listened to experts, they've listened to people from other governments, and they've responded with something that I think is a significant step forward, and that we are now going to have in these 5 shelters embedded medical professionals who are going to help keep people healthier here, and I think that's very important.
Essential health services like mental health supports, chronic disease management, and wound care and others will be available within shelters.
That's not the way medical services have traditionally been delivered, and it's had a profound impact on one of the city's most vulnerable populations. In the first 9 months of 2017, there were 70 deaths in Toronto's homeless community. Deaths that may have been prevented had those individuals had more timely and adequate access to medical care. The average age of death was only 48. Today's announcement will ensure that healthcare professionals are on site and providing care to people who need it where they need it. And some with lived experience say it's a major step forward.
It's a matter of everybody collaborating and working and focusing on the same strategy going forward. I think if we can achieve that, then we can achieve perhaps what I'm looking for is an end to homelessness altogether.
An ideal goal, to be certain. Now, today, the province also announced funding for 244 supportive housing units to help transition individuals from shelters into housing. The first of those are expected to be open over the next couple of weeks.